Randall Harper. I live in San Antonio, Texas. Been here since 1964. And I am a physician with a specialty in pathology, retired in 2002.
My name is Shirley Harper, and I live in San Antonio. And mostly I've been a homemaker. I taught for a few years when he was in medical school, but I've been fortunate to be able to stay home with my children.
No, I wasn't. It was during the Vietnam era, but I was very fortunate. I was spent 1 year in Denver, Colorado, and the other 7 years in San Antonio, Texas. I was teaching the School of Cytotechnology, where they learned to screen pap smears, and they said, we don't need any of those people in Vietnam now. In summer of 1975, at church one night, a person I knew who is a nurse, he and his wife are both nurses, and he was stationed out at Brooke General Hospital, as we called it in those days, and he knew about the Tron family and knew that they needed some help. So he asked me if I would be interested in going over and talking with them. So I went over that evening after church, and it was an amazing meeting for me, because as I went in, the family was all there. I sat down, and they had the little 5-year-old Anne brought a tray of refreshments for all of us to drink. And I just thinking, as I looked around, these poor people, they don't have anything, but they're wanting to, in some way, welcome me and give me a refreshment. And so as we talked, and I understood what their situation was and what they wanted to do and how little they had to go on at that time. In fact, at that time, Dr. Duke, a physician who was practicing in Vietnam, would catch a city bus, ride downtown to Santa Rosa Hospital, go to the laboratory where he was a phlebotomist. He would go up on the wards and draw blood from patients, with the lowest paid job there is in the hospital, but he knew he had to do something, and he wasn't certified at that time to practice here. So I was just amazed at how much stamina they had and how much they were planning on making it one way or another.
No, I had no objection whatsoever. I think the Lord had prepared our hearts before we ever met them, so we were both very receptive to this.
I think they adapted much better than I could have if I'd have been in Vietnam trying to learn their language and their culture there. They just worked as far as one of them would work while the other one was studying, preparing for getting recertified. And of course, on all the recertification, it was in English. And even though they knew the things, it was very hard for them to, and I can understand why. It was hard for them to pass those exams, because they had to be able to translate all they knew and put it over into the English. And so they just kept sticking with it. And and they were always so positive. They were smiling. You would never know they had a trouble in the world. Yes, we, back a few years prior to that, we drove nothing but Volkswagens. And so when they were here and riding the bus, we also, I don't know how long it was that they stayed in the little apartment they were in, but we managed to get them an apartment closer to us, and realized that he didn't need to ride the bus every day, and family needed to go to church and things. So we managed to buy a Volkswagen for them to drive.
How much did you spend for that Volkswagen, can I ask?
Yeah, it was used, and I think it was around $1,000, but I don't know exactly, because the brand new ones were only $2,300 in those, $2,300 with an air conditioner in those days.
Wonderful. Getting back to the profession is not easy. Even the people born here, if they want to be a doctor, you have to go through length of time, and also difficult in schooling and everything. How did they do it?
It was just by sheer determination. I think a lot of people would have given up before they got through, because, as I said, one of them would work to make money for them to help them live on, while the other one would be studying and took some refresher courses and just kept on and on until they finally could pass the exams.
You remember the day that they passed the exam and back to their MD again? You remember any story about that day?
I just remember what a relief it was and how excited and happy they both were that he had finally gotten that behind him.
Was this your present, was the Volkswagen, or you gave them before?
I'm sorry.
Did we give them the Volkswagen then, or
Oh,
no?
no, we'd given it to them quite a while before
Yeah,
that.
early on.
Uh-huh.
Thank you. Can you recall what's the most challenge during you have Dr. Duke and his family under your wing?
I discussed this with Shirley last night, and I couldn't think of any challenge, and she said the only challenge she could think of was that trying to get them to tell us what they needed. They were just a wonderful couple to work with, and of course their children were also.
Wonderful. Mrs. Harper, can you recall that during that time you have 2 children of your own?
Yes.
And they have 3?
Yes.
And then you get together quite often. Can you remember any happy story or anything at all that you can share?
Well, I just remember that they liked shrimp, and I'm not a cook, and I would go out, and there's a place in San Antonio called Sea Island, and we'd bring in shrimp, and we'd have a big dinner. And one of the things I remember most about Toette, though, she would bring things, and she always, I think all of the family enjoys the beauty, so she would try to make everything very fancy. The little radishes would become flowers, and she would make log cakes, and it was just always, because I was rather plain, and she always did everything with such beauty. So that's one of the things I remember. I remember the children were just delightful, and unlike many American children, they were always very disciplined and very obedient and that sort of thing.
Yes. Ma'am, I saw a lot of beautiful picture, like a history, picture of family. And can you tell us a little bit about your family? They came from Texas?
No, I grew up in Kentucky, and my family, we had very little, but my dad was a very hard-working man. Most of the background, the families were farmers in Kentucky, but my dad rather broke out of that mold, and he was a contractor. But we always, even though we didn't have a whole lot, we had a wonderful family, and it was, I had a good time being raised in Kentucky.
We see that you done a lot for people who need it. You and your family sponsor the Tran family, and your son, I believe, also sponsor another little girl from China. Can you elaborate
Yes.
a little bit about that story?
Yes, our granddaughter, who is, her nickname in Chinese is Xin Xin, and her parents still call her that, but her American name is Chloe. As you know, in China, they have a one-child policy, so Chloe was found on some rural road in southern China, and she was picked up and taken to an orphanage. And then she was one of the fortunate ones who had a foster family for about 6 months, and then our son Scott and his wife Stephanie adopted her when she was 10 months old, and she's just been the greatest joy for our life. She's in ballet, she plays the violin beautifully, and it's just been an extraordinary experience having her in our family.
The two of them I just describe as energetic, Christian, hardworking, never give up type people that are just a pleasure to be around. And the children, of course, both of them were just so well disciplined, so nice, that they also were a pleasure to be around and have them in our house and be with our family.
Thank you, sir. And what was your most reward when you did that for the Tran, you think?
I think the most reward, the biggest blessing was just seeing the two of them get recertified in their own area of specialty, and then seeing those three children excel so academically, even in graduate work, and then becoming successful in their chosen professions.
What my husband, he echoes what I would have said, and but I think that when I look at the children particularly, that they I'm so pleased that they've had the opportunities that they've had in America. Not to say they wouldn't have had in Vietnam, I don't know, but they have taken every opportunity that they were given, and they've made the most of it. And as well as Duke and Tuet, and have a lovely home now. And when I contrast that between what they originally had when they came and what they have now, it's really rewarding. But also, I'm very impressed by their Christian life and the way that not only we helped them, but they paid it forward, and now they help so many others. And I think maybe that might be the biggest reward. I think it was providential that they were put in our lives, and we were just overjoyed that we had the opportunity to do that and had the means at that time to be able to help them. And I think it was a blessing for us as well as a blessing for them.
I knew that he had worked hard enough. Thought he could do it.
How you value his work in the military, and his contribution, how he do in the military?
I think he was a great asset to the military. I'm sure they were very happy he was there. He and I weren't in the military at the same time, but I know enough about how the military operates with my 8 years there that I know that they were very happy to have him there. Well, I'm not really sure. He and I didn't talk about that very much at the time as to why he decided to join the Army versus doing pathology. So I really can't answer that question. I had finished medical school in 1964. Mm-hmm. 1963, excuse me. I'll restart. I had finished the medical school in 1963, and at that time it was well known that either you join the Army and do training in there, or you take civilian training, and then you immediately, if you agreed to take the civilian training, you were agreeing that then you would go into the Army for 2 years. And as I looked at it, and as we had nothing financially, my wife was working all the time, I was going through school, I was working at 3 different part-time jobs, and either I could stay there at Louisville General Hospital and draw $100 a month as an intern, or I could join the Army, and I was bringing home over $500 a month. We thought we were rich, and did my internship there, and then did my residency there, and then did my payback time so I could get into private practice only 2 years later. So it was just a financial decision as much as anything, but it was wonderful for us. Wonderful. I didn't have any family members or close friends that were in the military at that time, and all the people that I knew in the military, their main objective was to not have to go to Vietnam if they could avoid it. And so I don't have any plus or negative about how the people felt at that time. Well, the one thing I was going to say, and I think Shirley sort of touched on it, was the fact that we never one time stopped and said, maybe we shouldn't have sponsored them. We were always very happy that we did.
Now, back to the Vietnam thing. My one memory of this, which was quite sad, we lived over close to Brooke Army Hospital in a small house at the time, and across the street from us, people moved in. There was a man who was a pilot and his wife, and I don't remember how many children they had, but I remember one little boy particularly, and the pilot went to Vietnam. I remember before he went, he would be out mowing the lawn, and his little boy had a little toy lawnmower, and he would follow behind him, and the pilot was killed. And I remember the day they came and told his wife, and I remember just the incredible sadness that I felt for that family. But those were the only people that I really knew that were affected that drastically that I knew personally, and I don't remember their names right now. It's been a long time ago. But for the Tron family, I just remember they're such delightful people, and I remember having thought that I don't think I could be this cheerful in these circumstances, but they had the most positive attitude, and they were just going to succeed, and we knew that. We had 2 boys, so I had not had the pleasure of buying clothes for little girls, and so I remember things were very different then. There were no Babies R Us or big stores for children's clothes, and I went to Sears and I bought dresses for Maya and Ann, and I just had the best time. And I bought clothes for Long too, but I ordinarily bought boys' clothes, so that wasn't a big change. But I remember what fun I had buying the little dresses for Maya and Ann and the other clothing, and it wasn't a lot. It wasn't a huge amount. It was just enough that they could get by. And I remember they were very grateful always for anything that we did.
Yeah, one other thing it just dawned on me that I certainly should say, and that is, we are so thankful that God has blessed us so that we were able to do that, because we both grew up with nothing, but God had blessed us in such a way that we could help others, and it was a real blessing for us to see them succeed then. I'm just so happy that we were able to help the Trons like we were, but it would be amiss if I didn't say that it was only because God has blessed us so much, because we grew up with so little. We neither one grew up with much of anything. I grew up on a farm in Kentucky, and we just barely could get by growing our garden and milking the cows and killing the pigs and so on. So it was a real pleasure for us to be able to help other people. I was very fortunate in those days because my parents, neither of them even had a 6th grade education, but they could recognize the importance of education, so they encouraged me. And I had a vocational agriculture teacher when I was in high school, and he encouraged the students to have a cow or 2 on the farm that would be theirs, and to grow some crop that would be theirs. So when I got ready to go to college, I sold the cows, and I'd saved the money, and I could use that for going through college. And then I worked at a grade A dairy going through college. And then after that, Shirley and I had married, and I borrowed a little bit of money, but it didn't cost nearly as much to go to medical school back in those days as it does now. So by her working and me working at some part-time jobs, I came through medical school with, I think, probably no more than a few $1,000s debt. So it was just, I don't think a person could do it today. And I know a man who knew Shirley's father said, I don't know how that boy thinks he's going to go to medical school. He doesn't have any money. And he was right, but I just didn't know you couldn't do it, so I went on and did it.
I like him. Perhaps we had a bit more than they did, but we grew up, we thought we were poor in what we ate, and we realize now that we ate healthily because we had a big garden, and we ate vegetables all summer, and my mother canned or froze the things that she harvested from the garden. And so even though we had very little, we always had enough to eat. We had clothing, and it was we had a happy family, so that was the most important thing. It was hard.
Yes.
Like he said, he had 3 jobs in medical school,
Yes.
and so he was home very little. They were just part-time jobs, and I had to study, and I worked. But I think the Lord always, we're Christians who strongly believe that the Lord guides us and provides for us.